Hey, hello, and we are talking today with Julie, who's a pharmacist at the Wicker Pharmacy in Sheffield. Julie's agreed to have a quick conversation with us today to just share some of her experiences of delivering the pharmacy contraception service, just so that hopefully there'll be some top tips and tricks in there about how to get going and make it part of your normal day-to-day. Julie, welcome. Thank you for taking time to talk to us. I'm just wondering, for the benefit of anybody watching this, if you can just start off by giving us an idea about how your pharmacy goes about delivering the pharmacy contraception service.
Hi, right, okay. So we have a number of different ways into the service. We do occasionally get walk-ins, people just come and ask for it. But the majority of hours are actually pre-booked. We have an online booking system attached to our website where people pre-book, and the bookings are only available at times when there is more than one pharmacist, or there's a pharmacist and an ACT on. So the work in the main dispensary can continue to flow while the pharmacist is potentially out of the dispensary for it. Well, you never know how long these things are going to take until you start. So I say if you're just new to doing the service, I would allow yourself 15 to 20 minutes, just so you're not feeling under time pressure. Some appointments are much quicker than that, but that's kind of the maximum end. And it's like any skill. The more you do it, the quicker you get, the easier it gets. The first consultation's always going to be your hardest one. So just get that one over and done with. So we'll have walk-ins, and the walk-ins will be people directly coming for their regular consultation for contraception, or if people come in for an emergency morning after pill emergency contraception, then we will usually take them in the consultation room for that, and while we're there, see if the mini pill would be suitable for them. They might need to signposting elsewhere if they're wanting a coil or a depot or implant or one of the other forms of contraception. But we do get a fair few number of women where we are. We're a city centre pharmacy, so we do recruit quite a few people that way. And then there's a couple of GP practices in the city that just don't prescribe contraception. They signpost everybody to local pharmacies. So yeah, we get quite a lot of their ladies booking in to see us. They're usually a little bit surprised the first time. They're like, oh, I don't know why the doctor sent me here. But you know, once you've got them there, you sat them down and you made them feel comfortable, they love it. They keep coming back.
Great. That's always a good sign, isn't it, if they keep coming back? And that was really helpful to just hear how you've sort of integrated that workflow into the sort of normal day to day. So what I'm hearing is there's a mix of pre-booked appointments that you've got operating through a web-based system, as well as having people just walk in to access either routine contraception or the emergency contraception.
Yeah. And
When
also
when
with those walk-ins, if they come at a busy time, we would book them in and ask them to come back at another time.
Right.
Because I think in pharmacy, it's a bit hard to get away from, well, for me, it's been hard to get away from that idea that we've got to do everything now.
Yeah.
And we don't have to do everything now. And when people are coming, when women are coming for this type of service, they are quite happy to come back at another time.
Yeah. And who, in terms of in the pharmacy team, how have you sort of prepared the rest of the team to deal with that kind of demand? Because I presume it'd be people on the counter, dispensers, pharmacy technicians who might be sort of handling those queries rather than it being direct to pharmacist.
Um, yeah, well, we've been doing it so long now, everybody kind of knows we do it, and they just get
Yeah.
referred. You know, I'll either get a name and a phone number, and I'll phone them up and book them in, or the staff will say, oh, if you go online, you can book yourself in. Or the staff will even go online, because they can go online on the tills now and just book them in there, and then through our system.
So just to make it as easy as possible for people. Yeah.
Yeah.
Okay. If you think back to when you were getting ready to really get started with delivering this service, can you think back to maybe sort of what some of the steps you took in the pharmacy and with the team to sort of get ready for being super active?
I mean, I think you need to have a pharmacy team that can run without the pharmacist being in the dispensary for 10-15 minutes. And I think now that we're all doing pharmacy first, I think that's more common. But you do have to pick your times. You know, you need to be doing this when you've got a good team on. You can't do it on the day that, you know, your main member of staff phoned in sick, somebody's on holiday, and you're really up against it. So I think it's just about identifying the times of day when you're under less pressure, because all pharmacies have a sort of flow of work through the day and through the week. And just making sure the staff are comfortable saying to customers, it's going to be however long. Do you want to call back? Do you want to, if you deliver, you can offer to deliver. Phone calls, take names and numbers, you can phone them back. You know, keep all the work in order so that when you do come out, you can just whiz through it and get it all moving again. So I think, yeah, there is quite a bit of work to do with your team. But there's more and more things now that take the pharmacist out of the dispensary for a few minutes. And that sort of approach is going to help all of those services.
Yeah. Okay, that's great. Some really helpful tips in there, I'm sure, for people. And just thinking about sort of working with other healthcare providers across primary care, what's your experience been like, you know, working alongside GP practices or other sexual health providers? Can you share with people who might be watching this any sort of things that you've done around establishing sort of more formal referral pathways, or where you then signpost back in if you need to? Anything you can sort of give us a bit of an insight to there?
Yeah, I mean, I must admit, it's the vast majority are very straightforward, and we don't need any extra communication with GPs or other services. I think, I mean, I don't know how many consultations I've done, hundreds now. I can only think of 2 where I've had to speak to somebody else. So one would have been the GP, because the lady fell outside of the PGD, so we couldn't help her. And then I had another one where she didn't want to go to the GP for contraception. So I spoke to Sheffield Sexual Health Services at the Hallamshire Hospital. And it was a little bit tricky getting through to the right person. But once I got through to one of their consultants, she was absolutely brilliant, really, really supportive. And this particular young lady then got her needs met. So I had to be a little bit pushy there to get hold of the right person, but now I know. Now I know to ask for a consultant. Yeah, I feel quite confident that I've got backup if I get something really gnarly, where you've got drug interactions, or, you know, anything that just doesn't feel quite right or outside the scope of the PGD.
Yeah, well, that's good to hear. It's good to be tenacious, isn't it, sometimes, and make sure you get through to the person you need to speak to, but good that you felt supported once you have. What has sort of worked well for you in terms of the relationships with your local GPs and the sexual health service around promotion of pharmacy contraception service?
I mean, I think everybody's very busy. So the GPs, once they realise you can do it, they're actually really happy to lose that workload. I mean, we do nab some women when they come in and ask for their blood pressure checking, because the doctors haven't got time to do it and they need it to get their next pill. And they'll come in and say, can you do your blood pressure? I'll say, yeah. And they go, oh, it's from a pill. So, oh, do you want me to do that as well? You know, and we get them there. So, yeah, I mean, we've certainly not had any negative feedback as well, which is always good.
Right, great to hear. Is there anything that you think could sort of make it better? So thinking about, you know, obviously you're quite well established, you're delivering quite a high volume of consultations for this service. If you were to give somebody who's maybe only just sort of scratching the surface, maybe only tried a couple, still maybe needs to build their confidence around offering this to their community, what might be some pieces of advice you'd give to them about establishing a relationship with their local GP practice?
I mean, you just got to talk to them. You know, you need to be on the phone and just building up a report about anything. It doesn't have to be about this. I think once the surgery, I know we do a lot through AccuRx now rather than actually speaking to people, so that's a little bit of a different dynamic, isn't it? But if you're using AccuRx to communicate with your doctor's surgery, make sure you put your name on it, make sure you put and reply and do all those things so they know who they're speaking to, and you start to build a rapport with the different people in your GP practice. And it's a bit tricky because different practices have different people responsible for different things. Quite often contraception will be nurse-led service as well, so it's not always the doctor that you would need to communicate these things to.
So having a little personal touch is what I'm hearing, making sure your name's on there, that you get to know some of the key people at the practice, let them know that you're offering the service. And what is feedback? You've said already that some of the ladies that have been coming in have liked and welcomed the service. Have you got any more insights about what general feedback's been from people that you've looked after on the contraception service?
They seem to really like it. They find it very accessible and easy. They're not having long waits. We're quite flexible with appointment times. They can come in on a weekend, or at times when the surgery isn't necessarily open. We do always do our best to fit them in as soon as possible if they're running low as well. And it's always quicker to do a repeat supply than it is to start somebody. When you're starting somebody off, there's quite a lot of information to get through. So I think it's the flexibility of the service. They like the personal touch as well. They like to feel that they saw you last time, they're seeing you again. If there's any issues or niggles, or if the first pill, if it's combined and the first pill they started doesn't quite suit them, they're having these side effects, they like that you take that seriously and you discuss it with them and you look at maybe tweaking it to something else, and just sort of fitting it around them, really. They love the tailored regime as well, if you get into that. So with combined pill, there's the traditional take it for 3 weeks, week off. Then you can have 2 packs back to back, so you get your period every 6 weeks. Then you do tailored regime, take it every day until you get breakthrough bleeding, stop for 4 days, back on. I've got a few women that absolutely love that tailored regime because they have really problematic periods, and that means that they have the absolute minimum of periods necessary. And just offering them those options is really helpful, because a lot of them haven't previously been given those options on how to take a combined pill.
So they get the realization that it's not a one size fits all, and you're actually listening to what's important for them as well, which is just fab. What challenges have you encountered, if any, in delivering this service in your pharmacy?
I think when they fall outside of the scope of the PGD, or if they want a contraceptive that's not on it, particularly patches. In Sheffield, getting patches is quite difficult. They can only get those through their GP service, which is a shame, because it is just a combined contraceptive. It's a shame it couldn't be added to the PGD, but there we go. Or if they're on medication that interacts, if they're getting a little bit obese, if they're smoking or vaping and over 35. So sometimes in those cases you have to say, well, if you're getting the service from me, I can only offer you the mini pill, but if you want to discuss it with your GP, they may be prepared to offer you an alternative. So that sometimes you have a bit of an awkward conversation there, where they want something that we can't do with the PGD.
It sounds to me, what I've heard there is that you've really worked on the phrasing that you're using to explain it in a way that somebody would understand, that's not the technical terms in the PGD or the exclusion criteria. It's being able to say, if you want to get it from me, this is what I can work within in terms of the boundaries that I'm set. Okay. And just to sort of finish up, to sort of just wondering if you can sort of give people a bit of an insight as to what has this meant for your for you personally, in terms of what opportunities has this given you, and what opportunities has it given the pharmacy team and the people that are using your pharmacy? What's your sort of viewpoint on that?
I do really enjoy doing the service. And I just think it's really nice to use your skills as a clinician and to be able to listen to the patient and see what they want and what they need and give it to them. Previously, for many years, patients would come in and complain to us, and you say, well, I can message your doctor, I can do this, I can do that, but you couldn't actually get in there and solve the problem. Whereas now we can, and if people are going on holiday and they need a longer supply, you can, or yeah. So I find it's really rewarding, and of course now I've been doing it a while, so I'm seeing the same ladies again and again.
Fantastic. And it's great to hear that you're sounding so empowered with it as well, in terms of what you're able to do. Thank you so much for your time, Julie. I know other people out there will take a lot from listening to this conversation, and hearing your top tips and tricks. Just like to say to everybody that I'm Joanne Lane. I'm the Chief Officer at Community Pharmacy South Yorkshire. And if anybody's wanting any further information or advice about delivering the contraception service, please do not hesitate to get in touch with us via the LPC office. Julie, for now, thank you once again, and we'll look forward to seeing you again soon. Thanks.
Thank you.